Ever get this weird feeling like you're so busy taking care of what you can see, but forgetting about what's hiding beneath the surface?
Oh, absolutely.
Today we're tackling a dental issue that's kind of like that root decay.
It is. It's sneaky.
Yeah, it really is.
Yeah.
We're going to unpack what it is, why it seems to be more common as we age, and most importantly, what you could do about it.
Sounds good.
So root decay, what is it? And why should we care, especially if, it's not like we can see our tooth roots every day.
Right. Well, think of it like this. Imagine a cavity,
Okay.
but instead of happening on the hard enamel surface of your tooth, it's happening on the root.
Ah, I see.
And the root is covered by a thinner, more vulnerable layer called cementum.
So it's like weaker armor down there.
Exactly. And that makes it more susceptible to problems.
So if it's not just about forgetting to brush our teeth, what else is going on? Why does this happen?
Well, you're right. Brushing and flossing are still super important,
Of course, yeah,
but it's not always that simple.
right.
Our source points out that there's a whole bunch of everyday things that can actually increase our risk.
Really? Like
Yeah.
what? I'm genuinely curious.
Okay, so have you ever thought about how certain medications can actually cause dry mouth?
Oh, that's true.
Yeah, and when you have dry mouth, it means you have less saliva.
Right.
And saliva naturally washes away bacteria.
It's like our mouth's own little cleaning crew.
Precisely. And here's another one. Even brushing too hard. Like if you're really getting in there,
Oh no, am I guilty of that?
well, it can wear down your gums, leading to recession.
Oh, I've heard of that.
And when your gums recede, guess what?
Uh-oh, those roots are
You
exposed.
got it.
Wow, so even something meant to be good for our teeth, like brushing, can backfire if we're not careful.
It's all about balance, right?
Exactly, finding that sweet spot.
And this is where things get really interesting. Our source actually connects root decay to our overall health.
Wait, really? Tell me more, because that's not something you hear every day.
Right. So they list things like diabetes
Okay.
and even, get this, previous strokes as potential risk factors for root decay.
Now that's a connection I never would have made. How are those things related to what's happening in our mouth?
That's the fascinating part, right? It all boils down to this. Our oral health and our overall well-being are way more interconnected than we often realize.
Like our mouths are a window into what's happening in the rest of our body.
Exactly. And on that note, there's one more big player our source highlights when it comes to root decay. Periodontal disease.
Periodontal disease. Now that sounds serious.
It is. It's essentially a more severe form of gum disease.
Okay, so we've all heard of gingivitis
Right.
from those toothpaste commercials.
Exactly. But periodontal disease, that's like the next level.
Okay, so walk me through this because I need to know what I'm dealing with here.
Basically, it's an infection.
Okay.
And this infection, it doesn't just target your gums, it also affects the bones that support your teeth.
Oh, no.
Yeah. And as it progresses, your gums start to pull away from your teeth. That's the gum recession we were talking about earlier.
Oh, right.
And guess what happens when the gums pull away?
Those roots are left defenseless.
Exactly. They're exposed.
So it's like opening the floodgates for decay. So to anyone listening who's ever been told, hey, you've got a little gum recession happening, it's not just about how your gums look, right?
Absolutely not. It could be a sign that there's something more going on beneath the surface.
That's a little warning flag.
Exactly. And that's why early detection is so crucial.
So how do we catch it early? What do we do?
Well, it often starts with something I'm sure you're already doing. Those regular dental checkups.
So those checkups are more important than we think, huh?
More than you know.
So those checkups are more important than we think, huh?
More than you know.
So it's not just about, like you said, getting that stray popcorn kernel from who knows when.
Right.
It's about potentially saving ourselves from some dental drama later on. So let's say our dentist, they're doing their thing, and they spot something a little suspicious. What happens next? Because our source mentioned like a whole range of treatment options for root decay.
Right.
And they run the gamut from simple to like a little more intense,
Yes. Definitely. Think of it kind of like a spectrum.
Okay, I like it.
Spectrum. So in those early stages, we might focus on what's called remineralization.
Remineralization.
Yeah,
It sounds very sci-fi to me, I'm not going to lie.
it does.
But break that down for me. What are we talking about when we say remineralization?
So essentially what's happening is we're giving your teeth this mineral boost
Okay.
to help them repair naturally.
So it's like a supplement but for your teeth.
Yes, exactly. And this is often where, those fluoride treatments you probably had at the dentist as a kid. Oh, yeah, the foamy trays.
Exactly.
Yes. Those in times.
Well, fluoride plays a really key role in that because it helps to strengthen the tooth enamel.
So it's like we're reinforcing those walls before they totally crumble. Right.
Precisely.
I like it.
And in some cases, your dentist might even do a little recontouring of the affected area.
Recontouring?
Yeah, so they're smoothing it out so it's easier to clean.
Oh, so it's like less bumpy, less surface area for things to cling to, I guess.
Exactly.
Yeah.
And these are all, thankfully, on the less invasive side.
That's always good news.
Yes.
But what about those situations where, maybe we didn't catch it quite as early, maybe it's progressed a little further down that spectrum you were talking about?
Right.
What are we looking at then?
So that's when we might start talking about things like fillings or crowns, which I'm sure you've heard of.
Yeah, a little more familiar territory there.
Right. And these are kind of the tried and true methods for restoring the tooth structure.
Right.
And, importantly, preventing further damage.
Okay, so those are those classic solutions, but then there were some other things that our source mentioned that seemed a little, like the bigger guns.
Right.
Like, you're talking root canals, extractions, even implants.
Yeah.
Those are a little more intense, to say the least.
Those are definitely reserved for more advanced cases.
Right.
Where maybe the decay has reached the tooth's pulp.
Ah.
Or it's caused really significant damage.
So that's why our source really emphasizes prevention.
Exactly.
Because nobody wants to get to that point if they can help it.
Nobody wants to get there. Exactly. And speaking of different ways to approach this, I noticed our source mentioned a couple of treatments that I hadn't heard of before. Things like glass ionomer with fluoride and gum grafting.
Oh, yeah.
What are those all about? Those sound very interesting and new.
Those are really great examples of how dentistry is always evolving.
I like it. I like it.
So glass ionomer with fluoride, that's a type of filling material.
Go ahead.
But it's super cool because it not only restores the tooth, it actually releases fluoride over time.
What? That's amazing.
Yeah, it's like built-in protection.
It's like time-release medication, but for your teeth.
Yes, exactly. And then gum grafting. So
that sounds very like gardening to me.
It does.
But I know it's not the same thing, so tell me, what is it?
It's not quite the same, but essentially we're taking tissue from elsewhere in your mouth. Or sometimes using a synthetic material and actually grafting it onto the areas where gums have receded.
So it's like we're restoring what was lost.
Exactly.
And giving those roots some backup again.
Yes, and it's amazing for reducing sensitivity, improving your gum health, and just, giving your smile that extra boost.
I love that dentistry is finding all these new and innovative ways to address these things. It's exciting.
It's very exciting, and it just goes to show how important it is to take care of our oral health, throughout life.
So we've covered a lot of ground here. It's really amazing to hear about all the progress that's being made in dentistry. But I have to admit, all this talk about root decay and gum grafts and mineral boosts, it's a lot. So for anyone listening who's feeling maybe just a little bit overwhelmed or maybe even a little terrified of what's happening below their gum line, what are the key takeaways? What can we actually do to prevent this from happening in the first place?
I hear you. It can definitely sound like a lot, but honestly, the good news is a lot of it comes down to habits we already know.
Okay, so we don't have to reinvent the wheel here.
Not at all. It's more about shifting our perspective a little bit.
Okay, I like the sound of that, a perspective shift. So tell me more. How do we do that?
Well, we often think of things like brushing and flossing as just cleaning our teeth, right?
Right, like getting those spinach bits out.
Yeah. Exactly. But it's so much bigger than that. We're not just cleaning, we're actually protecting those vulnerable roots, too.
I see. So it changes the whole game when you think about it like that.
Exactly. And those regular dental visits we keep talking about?
Yeah.
Those aren't just for a quick polish and a see ya later.
Right.
They're about catching those issues early on when treatment is so much easier and less intense.
So it's about playing the long game with our oral health.
Exactly.
It's not about just sprinting to the finish line every 6 months at our cleaning.
Exactly. It's about those daily habits, making them non-negotiable.
So it's not about being perfect. It's about being consistent.
There you go.
Small steps, big impact. I like it. Well, this has been an incredible deep dive into the world of root decay. I've learned so much. Any final words of wisdom for our listeners before we wrap things up?
If there's just one thing you take away from all of this, let it be this. Our mouths are always changing throughout our lives. What worked for us in our 20s might need a little adjusting as we get older.
That's a great point.
So stay curious about your oral health. Keep those conversations going with your dentist.
Don't be afraid to ask questions.
Exactly. And never underestimate the power of those daily habits.
They really do add up.
They really do.
Well said. Thanks for joining us on this fascinating exploration of root decay. Remember, everyone, knowledge is power. So keep those questions coming, schedule those checkups, and keep brushing and flossing.
Absolutely.
And we'll catch you in the next deep dive.